Okay, this video is called Thoughts on Healing 2025. So this is made here in December, like December 19th, 2025. All right, so what's going on is I'm working on another book and I'm reading all these complex biochemistry papers about disease. And one of the things I've been reading a lot about is what you would call vicious cycles in disease, whereby you have a positive feedback loop that keeps causing the disease to get worse and worse and to never go away. And sometimes patients find themselves in these problems. And so a quick systematic discussion of this is worthwhile. Conventional medicine basically has two things to offer for the most part: drugs and surgery. And sometimes that's what you need. Functional medicine, so to speak, tends to recommend take a supplement. Okay? The holistic nutrition approach, diet and lifestyle. The best of them was Dr. McDougall, Kempner, Pritikin, that whole school, Esselstyn, of low-fat vegan diet with no oil. Okay, that's the best you can do there. Organic makes a big difference. And, organic is much more important now than it used to be, let's say maybe 40 years ago, but there's more and more problems with non-organic food, including the GMO, the paraquat, the rotenone, the glyphosate, the atrazine, etc. The synthetic herbicides and pesticides are pretty bad. Okay, and there's more to it than the food. The food's the most important thing, but there's other major things. There's tons of contaminants and toxins in your drinking water. You have to filter your drinking water or you're a stupid idiot, okay? What else? You ask yourself what causes the disease. Some things are obvious. High-fat diet causes hypertension and diabetes, so you want to eat a low-fat diet. That's obvious if you know anything about disease causation, and most medical doctors don't. What about the immune system? That's the other thing too. You should want to know what toxins will harm the immune system, what things will improve it. Saludogens is a word for something that improves health. That comes from Saluda was the goddess, Salus, the goddess of healing and health for the Romans, kind of the equivalent of the Greek goddess Hygeia, and for hygiene in the Greeks. They just take the Greek gods and give them a Roman name. And so we always talk about toxins. A toxin is something that harms health, worsens your health. A saludogen is to improve your health. And it's like, the Latin roots for the Spanish words. Salud is health. Buena salud is good health. Okay, so a saludogen is something that generates good health, saludogen. So you want to know the things that improve health. All right, what positive feedback cycles would I be talking about? Well, if you got chronic diabetes, hypertension, high-fat diet, psychological stress, caffeine, okay, sleep deprivation, that's going to make you hyperlipidemic. That's going to cause some tissue hypoxia. So you want to avoid that if you want to optimize healing. We've gone through all the mitochondrial inhibitors before. They're going to decrease your ability to produce energy. You need energy to heal. Okay, that can come from mitochondrial inhibitors, from diet, from medications, etc. You want to avoid, unnecessary air pollution. There's things you can do to that effect. VOCs, volatile organic compounds, solvents, EMF. Other types of vicious cycles that keep people sick is iron overload. Not well known, but nowadays they fortify, most of the processed food with iron. So men are routinely iron overloaded in the West after about 20 years of age, 25 years of age. Women after, about 5 or more years after menopause, they start getting iron overloaded quite a bit. So you want to avoid all that because that causes amyloid clotting, ferrous redox cycling. You want to avoid leaky gut, so you need your dietary fiber and to avoid all the gut toxins so you don't end up with LPS and LTA in your blood, endotoxemia, postprandial endotoxemia, with resultant amyloid clotting, okay? Being aware of all this dental stuff. We talked about this. I give plenty of lectures on this. My best lectures on this stuff's over at VegSource. I have some here at this channel. Amalgams with HG toxicity, root canals with the thiol ether toxicities, the whole thing about Western price and, the focal infection and then the localizing infection, all that stuff. I've later been going through some biochemistry papers and whatnot on the cell danger response cycle, the whole no cycle stuff. And in the past, I've gone through my own personal, my theories of back pain, my theories of cognitive decline, supply and demand theory, neurovascular uncoupling theory. And anyways, so when I went through Martin Paul's paper, I went through his 55-pager on the no cycle as a causative mechanism of CHF. He believes it's causing chronic fatigue syndrome, fibromyalgia, multiple chemical sensitivities, electrical hypersensitivity syndrome, PTSD, and possibly Alzheimer's, Parkinson's, ALS, asthma, some autoimmune diseases, and GWS. Okay, I'm not sure that it's doing all that, but I do think it's relevant. I do think it's good to know about, and I think he he sort of thinks, once you get this, you're screwed. It's going to be pretty hard to turn it around. But I actually think there's things I know that he don't know that can be done to really help turn these patients around. And I have a way that I can prove that. So anyways, I'm just letting you know, this is a more sophisticated, yeah, great. If you just go low-fat vegan, you cure everything, that's wonderful. There's good reasons why it might do that. But if you haven't cured it all just going low-fat vegan, you're gonna want to know more of this. And I made videos about most of this stuff, and I'm gonna make more videos in the future. I'm sort of consolidating my thoughts as part of writing some book chapters on this. So I'm just giving you a heads up. This is why I'm talking. This is why I haven't made too many health videos lately, because I'm thinking about this other stuff. And so I'll just do my quote stuff videos, and I'm try to do some Christian stuff, getting ready for Christmas. That's where things are at. So anyways, this is what I'm working on. This is what's coming. I think it's really useful, because bottom line is, when your cells flipped into these danger response, basically the cell wants to be healthy. And if conditions are good, there's adequate oxygen, glucose, and freedom from toxins, the cell just does whatever it's going to do. It usually means it's a worker. The liver cell works on being a liver cell. The brain cell works on being a brain cell. But when the cell's in danger, it senses, infection toxins like these bacterial endotoxins, or it senses chemical toxins, damaging tissue or something. Then the cell stays in a danger response, where it's just trying to heal, protect itself, and fend off a problem, and it won't do its job, and it'll potentially end up going into apoptosis and dying. So you want to fix the cell's environment before it goes into apoptosis and destroys the organ function. So anyways, I'll talk more about this later, but just giving you the heads up on where things are at. Thanks.